Good morning, good afternoon, everyone. Thank you for joining. I think we'll just give it a minute or two for people to join. I can see the numbers going up fast now, so let's just give it a little bit more time before we start. Thank you. Okay, so let's get started. So welcome everyone to this webinar on the launch of the Countdown profiles. I am Ties Boerma. I'm the director of the Countdown to 2030 for Women, Children and Adolescent Health, which is an international collaboration of academics, UN agencies, country public health institutions, Ministry of Health analysts, civil society, Partnership for Maternal Newborn Child Health, and others, which really tries to improve evidence for reproductive, maternal, and child health. And so we are very happy today to launch these profiles, because we think that's an important part of synthesizing and communicating data for action. As you've seen in the chat box, there will be simultaneous translation into French and Spanish. And I think most of the speakers will address you in English. These profiles, just to go back a little bit in time, have been around for 15, 20 years or so. And it was the countdown to 2015 at the time for first child survival, and then maternal survival, and then newborns, and it expanded to reproductive, maternal, newborn, child, adolescent health and nutrition. But these countdown was one of the first that really systematically put together the evidence from surveys, from international databases, from other health system kind of data, to provide a synthesis of the information that's available to guide program action. And I think that was a great step forward. And since then, there's been a mushroom of profiles and dashboards and things that try to put together these data in a way that they can be easily accessed by users, because very few of us have time to read big reports and other things. And it's very important that these numbers are vetted and checked by experts in the field so that they can be trusted. I think now, or 15 years later, we are at a time when we have many profiles, but we also have a deluge of data. There are many kinds of data estimates out there for many indicators. We've got many more indicators too. And one of the points of these profiles is to provide that synthesis of the experts to say, okay, this is the best numbers for this country, for this indicator, and this is data that can be trusted. So I think as these profiles have expanded over time, many more indicators and so on, they're still a very relevant source of information to guide programming and monitoring. So today we're going to launch several profiles. So first we have Jennifer Cuejo from UNICEF, which will talk about the overall continuum of care profile. We'll listen to the Dr. Helen Geary from Kenya, who heads up the MNE, to give some reflections on this profile. And then we move on to the equity profiles, which will be presented by Professor Aloisio Barros from Federal University of Pelotas. I think many of you know the work of Pelotas on equity. And then to early childhood development profile that will be presented by Claudia Kappa from UNICEF. We'll also hear from our colleagues from WHO what they've been doing in terms of monitoring the progress for the global strategy for women, children, and adolescent health. So, and then we'll close with the director of the PMNCH, Dr. Helga Fogstedt, and that should exactly last all 90 minutes. So I think a very exciting program. And so let me start with inviting Dr. Jennifer Cuejo, who has really been instrumental in the profiles in the countdown work. And now when she's at UNICEF, has been leading the work on putting together these very exciting information-packed profiles. So Jennifer, the floor is yours.
Thank you, Thies, for the introduction. As Thies mentioned, I am based at UNICEF headquarters, and I'm really pleased to have the opportunity to launch the Countdown to 2030, the 2021 profiles on behalf of the Countdown Profile Production Team. So I just want to pause a moment here to describe this production team and just to really emphasize how much this work was based on a partnership model. So the production team included 4 different sub-teams. The first was the UNICEF team. The second was our University of North Carolina Chapel Hill team that really spearheaded pulling us all together and keeping us on track and helping with the back end side of things. We also have a group of colleagues from North Carolina State University who helped us with the design aspects of the new profile. And then of course, the Countdown to 2030 Technical Working Group. Thies already described to you the composition of that group, but they really helped provide feedback and then also made sure that the changes were based in evidence and changes in global and national priorities. So I'm going to just describe to you a little bit about the Countdown to 2030 country profile, how these profiles are developed, and then I'll give a little bit of a deeper dive into the contents of each of the 3 profile pages. We also have a bonus page that we've added this year, and then of course the annexes that provide the metadata for each of the indicators on the profile. And I'll wrap up with a little bit of thoughts on how these profiles can be used to drive accountability for women, children, and adolescent health. So the Countdown to 2030, the country profiles are meant to be a tool for using data to improve women, children, and adolescent health. Thies already noted a little bit of the history. So the very first Countdown country profile was launched in 2005 with an emphasis on child survival. We had these profiles that were updated annually or every other year. And then as Thies noted, as the global landscape changed, the Countdown profiles also shifted accordingly and expanded to include the full continuum and embrace the whole women, children, adolescent health as the emphasis of the profile. The profiles are really focused on intervention coverage. That is one of the added values of the Countdown to 2030 initiative, is that it has this specific focus on intervention coverage. It also embeds the focus on the intervention coverage in a range of other data sources so that it's clear that when you're looking at it, how those intervention coverage measures relate to the demographic situation, to mortality, and to the policy framework. So what does the profile look like, and what is new for these profiles this year? As I mentioned, it now includes 3 pages. The profile since the beginning has always been 2 pages, but we needed to add a 3rd page, partially to accommodate some new indicators that we've added, and then also just to enhance the graphics that were on there so that the user could have a better sense of what the information was telling them. And then we also have a couple other additional things like the bonus page. All of these profiles are available online and are printable. The profiles still cover the continuum of care and are organized in a systematic way so that you get sort of the content areas of demographics, coverage, equity, policies, and finance, but also there's a grounding in the continuum of care. So each component has a spotlight from reproductive health, maternal newborn health, child health, and environmental aspects. Each of these profiles includes the latest available data for each of the indicators, and all the data that is shown on the profile is collected through a standard process and is signed off on by countries. That's very important. Lastly, we have, of course, a set of annexes to help the user understand the data sources and other pieces of information about each of the indicators. And it's also online. You're able to download both the country specific, if you're interested in just downloading the data for one profile, that's available, and also for the entire profile data set. This year, we also switched to a new online platform, and there were several reasons for that. One, we wanted to improve the interactivity of the profiles so that as you're moving through the interface that you can learn a little bit more about each of the indicators. We switched the platform to Tableau, and we have found that this is a much more flexible tool where it's easier for us to update and innovate in real time, and including getting user feedback and making changes fast. It's also a very cost-effective platform, and even still, it's also just an extremely effective way for sharing data visualizations. We just wanted to lay out for you that this is an iterative process that involves all of those teams that I mentioned before. So it's an intensive process that starts with a review of the profile itself to make sure that the data is being presented in the most compelling way, and that we also have the indicators that are most useful for countries for driving accountability and action for women, children, and adolescents. So that is sort of the first step, was a review of the contents of the profile and the types of visualizations. Then, as you can see, we had a process where we then engaged with the Countdown Technical Working Group experts just to make sure that everything was still reflective of the evidence base, and getting agreement around the way that we wanted to showcase the information. Then that sort of happened a few times where there'd be feedback between creating new templates, sharing it, getting feedback, and then ultimately landing on a final profile template, going through a quality assurance process, and then preparing for launch, which is today. Just again to spotlight, Tis has already noted that these profiles pull together a range of data. Most of the information comes from global databases and interagency estimates. As I've already noted, all of the data that's included on the Countdown profiles use a standard data collection procedure or a rigorous, transparent estimation process. And all of the estimates have gone through some sort of country consultation, and they are publicly available. This is to show you, I know there's a lot of information on this slide, but it's to show you the full tool, all 3 pages that put together, so that you can see how it combines the combination of coverage and drivers of coverage indicators all in one place to help users identify areas for action. As I've already noted, there is this additional bonus page that pops out the cause of death chart. And part of the reason for that is because there's so much information in that chart that compressing it a little bit like that, you can't see everything. So we thought it would be useful for users to have that additional page. So I'm going to walk you through now each one of the pages, just so you have a sense of what's there. The first page really sets the scene. It includes on here the bottom line figures of mortality. So we have the maternal mortality ratio and causes of death, and then also the neonatal, child and adolescent causes of death and mortality rates. Complementing that, then you can see Countdown's signature continuum of care chart on, for me, it's my left-hand side, but that again is sort of to show how a country is doing across the continuum for women, children, and adolescent health. Accompanying that is, those are all of the national averages, but then the corresponding column there shows the inequities or disparities in coverage by wealth quintile, which gives a better sense of progress of how well that country is doing in reaching everyone and not leaving any child behind. Then also there's the map that sort of breaks down how well a country is doing progressing towards universal health coverage through what we call the Composite Coverage Index. And of course, we have a large demographic section that helps put all of this information into context, including sort of basic statistics for the country around population, fertility, educational variables, birth registration, and we've added this year something on conflict. The second page, again, really dives more into that continuum of care chart and has more information on intervention coverage, including trends. And there's also a focus here on nutrition, both nutritional status for women and for children. So your stunting, wasting, overweight types of variables, and then information around nutrition interventions with a spotlight on breastfeeding. We also understand the growing importance of environment. So on this page, you also find some of the indicators around water, sanitation, and hygiene. And there's another little spotlight on equity, just to again keep in mind that these are national averages, but it's really important to get into disparities, which we'll hear more about next. This last page, the third page, is really a focus on the drivers of coverage, so that all of the information you've seen on page 1 and 2 is grounded in what's happening in the country in terms of legislative policies, governance types of indicators, like around if they've adopted costed plans and maternal death review, things like that. And then there's also an emphasis on service delivery types of indicators, so information on the health workforce and functionality of health facilities. Of course, we have to include financial information on the profile. So we have a combination of key indicators around domestic expenditures for health, and that is complemented by an analysis done by London School that shows official development assistance to women, children, and adolescent health in that country. We have included an extra box to also help interpret some of the acronyms that are on the profile, and includes a little bit of additional information for the user. This is what I was talking about with the bonus page. We're really pleased with this new presentation, moving from pie charts to this stacked bar chart, which we think is a much more compelling visual of the major causes of death in each one of these age groups, from neonatal, child, adolescent, and maternal, and feel this is very helpful for countries to be able to understand where programmatic priorities need to be focused. So just as I was mentioning previously, we're trying to make sure that there's interactivity to these profiles. So if you take a chart on the profile and you hover your cursor, for example, looking at skilled birth attendant, you will get a pop-up that provides more information about that indicator that helps you to understand its value for women, children, adolescent health. I'm going to now just describe a few examples or ways that the Countdown country profiles can be used to improve women's, children's, and adolescents' health. So starting with advocacy, the profile tool can go into the hands of civil society organizations and advocates to highlight where progress in a country has been unacceptably slow and where there are data gaps that need to be filled. These then, the civil society organizations and advocates can use this to help hold country governments and partners to account for making good on their commitments to the 2030 agenda. Secondly, we feel that the profile tool could be a very useful planning tool for country governments. So during their regular annual planning cycles, that the profile tool could just be a very strong piece of evidence to help guide discussions around where to prioritize investments and policy and programmatic priorities. The profiles and the underlying databases that are also available online are also very useful for academic and research institutions to use to assess progress and trends across countries and regions. We're also already starting on our next phase to keep improving the utility of the countdown profile and make sure that it's as useful as possible to those user groups that I just described in the last slide. One thing we really want to do is expand on the interactivity of the profile. We're planning on having some consultation processes with regional and country decision makers so that we get a little bit more feedback on what kind of information is missing or could be better enhanced on these profiles that meets their needs. The other part is, as I said, enhancing interactivity features for the profiles so that they are really most useful. The other is that, as you'll hear today, there are other there's a suite of countdown profiles. So we want to better link up all of these tools so that countries see them as a package that they can use together to drive action. We also want to embed in our online tool a means for gaining feedback from anyone that happens to use it so that that can also be incorporated into any revisions we make to the design. We're also planning to develop some regional profiles, which we think would nicely complement the country-specific profiles. And we also are interested in trying to do more outreach to increase uptake and use by country partners. That is that's the end of my presentation. I do also want to thank the Bill and Melinda Gates Foundation for funding Countdown to 2030, and also USAID for all of their support for the profile development, the database work. With that, I am now going to turn over to Dr. Helen Geary from the Ministry of Health of Kenya.
Thank you, Jennifer, and of course, Professor Tis, for that very good overview. I hope you can hear me.
Yes, very clear. All good.
Yeah, so I just want to just give some reflections on the uses of this really important and highly privileged, or is it prioritized profiles? Yeah, so I think this consolidation of highly synthesized and and reviewed data offers a very good opportunity for countries like Kenya to access data in one platform in terms of informing decisions, even doing reviews. Like recently, we conducted a midterm review of our strategy, and I think we are planning soon to conduct a midterm review of the RMNCH strategy. And I think this profile offers a very good, almost like a one-point reference point for really this high-quality data to inform some of these processes. As Jennifer has alluded, the profile is a good for both planning and review, because at the planning point, you're able to get a snapshot of where the gaps are in terms of coverage of interventions, inequalities, and even among the population who are where are the gaps, and therefore in planning, a government or a program is able to prioritize their plans In addition to that, we see it also as a point of reference for stakeholders, partners, civil society, even academic institutions to inform possible plans. And I think, for example, for stakeholders or for partners, we know that partners support governments in investing in progress in RH, maternal, child health, adolescent health, among others, and this too would give a good reference point on where stakeholders can also prioritize their interventions. The issue of highlighting inequalities in coverage, I think, in a country like Kenya, where we have the centralized system of government, I think the tool will be very valuable to us, hoping that there's that there will be some kind of iteration that can allow even for some national variations. Again, the element of hovering over an indicator and seeing a deep dive or more synthesized or more sort of disaggregated data, I think is very important for certain areas of interest, depending on who and when someone is looking at this profile. So I think the other advantage is the really wide scope of the tool, looking at all the way from cause of death, policies, governance, coverage, even going to environment, governance issues, gives the tool a really wide scope. As I mentioned, it's like a one source, single source sort of point of reference, all information that one would want to know to make a decision. Because as we know, health is very complex, and all these aspects affect health either as a risk factor or contribute to loss of health or gain of health in one way or the other. So the issue of looking at nutrition, environment, water, sanitation brings everything together into one data source. So I think in a snapshot, that is what I see as the use or the placement of this tool. And I think we'll be using it going forward. Thank you very much.
Thank you very much, Dr. Helen, for those great comments. And I think you raised a number of really important points around subnational use, comprehensiveness, and I'm really happy to hear about how it fits with national needs and priorities. And thank you, Jennifer, for that great overview and all the work on this. Now, as we saw, very colorful profiles, and Brittany has put the link in the chat box. So if you click on that, you can get right into your favorite country profile on the Countdown website. I think it's really wonderful. Please put your questions or comments in the chat box, or if you want to, we have a minute or two. If you want to intervene, raise your hand and ask a question. Maybe I just want to raise three points for Jennifer. I think one, you said it was Tableau driven. And so just for us to reassure us, does it make any difference for the users, or is everything just, it's under the hood, don't worry about it? Second is, you mentioned a little bit about comparisons with other countries and regional profile, you said at the end. Is it possible to compare with other countries electronically, or does this need to be done manually? And then third, how do we know when we get a number, whether it is an estimate or whether it's actually empirical data? And I'm asking that because, we have a lot of estimates that are in a way predictions of the past trend, But we also have a lot of numbers that come from surveys. They're corrected for biases, but there are actually data from now. They don't involve any prediction. So how does the user know whether they're dealing with a prediction or something that comes from a data collection effort in the country straight? So those are just 3 small questions, Jennifer. And I see no other questions at this point, so maybe you could answer those.
Sure, thank you, Thies. I'm going to start with the last one first. So as I noted, the countdown profiles accompanying, there are 2 ways that the user can find out more information about the data source for the particular indicator. So one, as I noted, we've added a tooltip function. So if you're hovering over the profile, the metadata for that indicator shows, and you can see if the source was a household survey or if it was an interagency estimate from which it was generated. So that's one way that the user can understand that information. And then the annexes are very extensive in explaining the data sources and the definition of each of the indicators. And we also have an annex that describes the indicators on the profile that go through an estimation process. That process is described in the annex for each one of them. So there's a section on the mortality indicators, on the WASH estimates, and on the ODA estimates as well. So I hope that answers that question. The other on comparison, it's a great question and something that we want to build on. So the next phase to answer this part is that's one of the reasons why we wanted to generate a regional profile so that there could be some benchmarking of the country in terms of how it compares next to the national, the average in the region. Comparing country to country, at the moment, there isn't a way to have one profile up and then show and then have a pop-up where it is if you to select another country for comparison, but that is definitely something we could explore. What you could always do is download and print out the 2 countries and put them side by side and compare them, but it's something that we should look into and how to make that a little bit easier for users to do. Just to note, as I mentioned before, the data that is included on the profiles is comparable. So that is possible to do. It's just, as you're saying, making it easier for people to see on the interface the relationship. The under the hood issue on Tableau, I don't, full disclosure, I'm not that isn't my strength of developing all of the backside of things, but to me, the Tableau, it's a very simple tool that there isn't anything under the hood or manipulation of the data. It is what it is. There's nothing that happens from the underlying Excel database. There's no manipulation of it when it comes up. So there isn't a mystery under that.
Thanks, Jennifer.
Thank you.
Just very quickly, there are 2 questions in the chat box, and they both ask, how frequently is the dashboard updated? Maybe you could answer that one very quickly.
And we are trying to move them to more of a real-time update. At the moment, it has been annually, and that is because there's usually a country consultation process that happens annually for those coverage indicators and also the mortality estimates. So currently, we've just been doing it to match with that cycle of country consultation process so that everything has been vetted, as Thies had mentioned before, that's really important.
Okay, so that is annual. That is annual, but you're going to update it more frequently. Say, for instance, if there's a new survey, then it would show earlier on the profile. Is that correct?
For example, the new. Can you hear me now?
Yeah.
Okay, thanks. Sorry. Yes, that's the idea, is to be able to pull in the information as it's updated in the backend database. So when a new survey comes out, that would be ideal. Yes.
Okay, I see several questions for you coming in on the chat box. So since you were going to manage that anyway, I'll defer to the chat box there, and maybe we can revisit some of these issues now. But looking at the time, without further ado, I'd like now to move on to the second profile of the day, which is the equity profile. equity is core in the countdown. We are so lucky to have the Pelotas University group working with us, with Cesar Victora and Aloisio Barros, and an incredible number of talented people who are leading the equity work in the world. So, Aloisio, over to you to introduce the equity profile.
Right. Okay, let me try to set up things here. Can you see my screen?
Yeah.
Great. Okay. I think
we have a shot of the website.
Sorry?
We see the website now.
Website?
Yeah, we have a screenshot of equidad.org dashboard.
Gosh. There's this.
Not to worry, it's probably a bug of Zoom today because Jennifer had the same problem.
It's interesting how sharing can be.
There we go. You're okay now.
Okay, good. Okay, so I am Aloisio Barros from the International Center for Equity in Health, Federal University of Pelotas, South Brazil. And well, it's my pleasure to be here to present and introduce the countdown equity profiles. These profiles here are the product of a real teamwork, and you see the pictures of our team here. The center has been running for more than 10 years now, but we sort of changed a lot over time. And a few years ago, we started to receive postgraduate students. So we have master's students, PhD students, postdocs, along with our tech staff, a librarian, designer, and well, the old guys in the old photos, so that we look a little bit younger than we really are. So Cesar and myself. And we have been doing this for some time now. And the joint effort of the group is something really important and really good. So we have the team working with the reanalysis of surveys, people sort of putting together the results that go into the profiles, a designing process, and so on. So it's a lot of work, but I think it's really worth it. These profiles are a big part of our dissemination work that's mostly done with the countdown, but also with other agencies and groups like WHO and PAHO and UNICEF, so that we try to make the equity analysis sort of more visible, more interpretable, and more useful to everyone. Another big part of our work is maintaining this mega database of surveys that we reanalyze. We now count more than 400 surveys in our database. And we also do science by training people, training postgraduate students, and we do our own work in terms of publishing academic papers on patterns and trends of inequalities, determinants, and so on. So it has been a really amazing experience working with this group that is so motivated and give a lot of their time to the center. The data that is the base for the equity analysis and the equity profiles, what we do is basically we reanalyze. Our work is mostly surveys, DHS, mixed surveys, and some non-standard surveys as well. So we reanalyze these surveys. Currently, we cover 117, actually 118 countries, more than 400 surveys, millions of women and children involved in these surveys. Our outcomes, as Jennifer mentioned, we focus on health intervention coverage. We also do this composite coverage index. I'll explain it in more detail in a moment. A co-coverage indicator and a few impact indicators like child mortality, nutrition, and fertility. And the difference of the data we work with is these standardized estimates of stratified indicators. So we work with all of these equity dimensions like wealth, women's education, age, urban or rural residence, country, region that are sort of more standard, child sex. But we have also included sort of more difficult and less common indicators like ethnicity, like women's empowerment. We also have been working with absolute income. That is a different way to compare countries and trying to have a look at the real levels of income instead of the relative comparison that is based in the wealth quintiles. The equiplot is sort of our signature graph. And you will see that there are several of them in the profiles. This is the result of a lot of exploration, trying to find what would be the easiest way for people to visualize coverage and inequalities. And we ended up with this one, where the dots represent the coverage for different subgroups. So in this example, we have 5 wealth quintiles. And so each dot represents one of those quintiles. So the dark blue is the poorest 20% of the population, up to the golden yellow that represents the 20% richest. So with this kind of graph, we can see the gap, the distance, the difference between poorest and richest, for instance. And in each line, we have different time points, like we have here from 1986 to 2013 in Brazil. Or we can have other stuff like different countries or different interventions. In this example here, I think it illustrates well the purpose of the graph, where we see that coverage and inequality decreased drastically in Brazil from the 80s, with a huge gap between the poorest and the richest, to the 2000s, where coverage is higher and the gaps practically disappeared. So we have really visible progress here. And I would say it's largely because the creation of our national health system, the SUS. And so that really made a huge difference to the country. So the profiles, the equity profiles, they include 4 pages. And the first page includes a map and equiplots and an infograph. And this is, I think, the most interesting part of the profile. Page 2, we have a table with the numbers, with the key indicators we selected so we have the estimate at national level and then estimates at the levels of the stratifiers we present. A third page with estimates by subnational region, and a final page with some information in terms of how to interpret the profile and the detailed definitions of the indicators. We have 13 indicators selected for these profiles. So individual indicators like demanding for family planning satisfied, so starting with reproductive health, going on to antenatal care, neonatal tetanus protection, skilled attendant at birth, and we go on to child health, vaccines, breastfeeding, and vitamin A supplementation. So we cover a wide range of this continuum of care for the reproductive, maternal, child, neonatal, and child health. And on top of that, we have the composite coverage index, that is a weighted average of 8 interventions that cover 4 stages of this continuum of care. And as a weighted average, it can be interpreted as a sort of an overall indicator of intervention coverage for the RMNCH continuum, and also as a proxy for universal healthcare. So it sort of combines everything into one number that helps us see how things are progressing over time, or helps us compare countries and so on. So let's zoom in on page 1. So we have a map, sorry. We have a map where we show the CCI for each of the subnational regions, usually administrative level 1. And so this is Nigeria that we selected because it's a big, important country, and well, usually presents also big inequalities. Big countries, and with all the problems that Nigeria has, it's always a big challenge to reduce inequalities. So we have the best region in Nigeria. We have the CCI at 64.7% compared to the worst region, 37.8%. So big regional differences. And we also have, beside the map, this equiplot, sort of a mini equiplot with the CCI at national level by wealth quintiles. And here we can see that there is a difference of more than 40 percentage points between the poorest and the richest 20% of the population. The next equiplot we have shows the 12 selected indicators, individual indicators by wealth quintiles. So we can see, have an idea of the levels of coverage and the size of the gaps between richest and poorest. Typically, we have a skilled attendant at delivery with the widest gap, and we see that for most countries, a huge difference. And if we pay attention for all of the indicators, we have the richest presenting the highest coverage, with one exception, continued breastfeeding. So at 1 year, the children most breastfed are the ones from the poorest group, and the least breastfed are the ones from the richest group. And it's very typical as well. We see that a lot across countries, that breastfeeding is something that is good, positive, and more common among the poor groups of the population. Well, the next graph we have is an intersection between wealth and urban or rural residents. And here we can see, for instance, that the poor in the rural areas are usually in a worse coverage situation than the poorest in the urban areas. So we can see it clearly here for skilled attendant at delivery, for immunization, for DPT-3, and so on. While the richest groups are sort of more or less the same, either in rural or in urban areas. Next, equiplot shows differences between urban and rural residents alone. And again, we see that urban residents are systematically better off in terms of coverage than the rural residents, except for continued breastfeeding at 1 year again. So it's sort of the same pattern as we saw for wealth. Then we have this co-coverage indicator. It's basically a count of how many interventions out of 8 selected, both the mom and the child received along the lifespan of that child. So we have a count that goes from 0, no interventions at all, up to 8, all of the interventions selected. And we present here this graph that we usually call a tie graph, where we see that for the poorest 20% of the population, more than 60% of the mom and child pairs received 0, 1, or 2 interventions. While if we look at the richest, we see that more than 50% of them received 7 or 6, 7 or 8 interventions. So a huge difference in terms of co-coverage, in terms of receiving all of the key interventions, both the mom and the child needs, between rich and poor. Then we have this infograph. It is very clever, but I think sometimes not so easy to interpret. What we have on the right side is what happens to the whole population in that country. So what's the proportion of all mothers and children that receive that are in the poorest quintile? So we have approximately 20%, 22% in this case, of all mothers and children in the poorest quintile. But where are the mothers and children with 0, 1, or 2 interventions? See that they are highly concentrated. 42% of them are in the poorest quintile. So we, in this infograph, can see how these disadvantaged pairs of mothers and children concentrate. So they concentrate in rural areas, 82% compared to 61% of the whole sample. They concentrate in the Northwest region, 53% of them compared to 36% of mothers and children in the Northwest region, and concentrated also among mothers with no education whatsoever. So the next pages, page 2, we present a table with the 12 indicators at national level, and then by wealth quintiles, by levels of women education, by child sex, and by area of residence. Additionally, we have the ratio between the richest and the poorest, the difference between richest and poorest, and 2 indicators of inequality. The concentration index, that's a relative inequality indicator and the slope index of inequality, that is an absolute indicator of inequality. I won't get into detail about these indicators, but you can learn more about them either in the last page or in our website. Page 3 is, again, the estimates for the intervention coverage by regions, subnational regions in the country. This, of course, varies from country to country. So some countries have just a few regions like Nigeria, 6 of them. In some cases, we have 25, 30 different regions. So the graph is a bit cramped, but I think it's very informative and very interesting. And finally, page 4, where we have all of these explanations in terms of how to interpret the graphs, in terms of detailed definitions of the indicators, the CCI and the co-coverage indicators explained, and so on. So they're sort of trying to help the reader to understand what's being presented. Well, you can find all of these these equity profiles in the Countdown website. If you want them now, just scan this QR code and go there. There you'll find 118 profiles for each of the countries. Each profile is based on the latest survey for each of the countries. We use mix and DHS surveys, and for a few countries, sort of local, non-standard surveys. And they vary from 1995 to 2019. It's a pity that some countries basically stopped running surveys and we don't have up-to-date information. So thank you very much for your attention. And if you have any questions or if you have any suggestions about the profiles, please don't hesitate to contact us by email or whatever way. Thank you.
Great. Thanks very much, Aloisio, for that wonderful presentation. And how beautiful are those equity profiles? I think the equiplot is a piece of art almost. You know, it's as very simple, it's easy to read, and it's beautiful. So wonderful work. We have some really good questions, both in the Q&A and in the chat box around high-income countries, around adaptations of the composite index, whether that's possible, and then even an error was caught. So I think I defer to those chat box and the Q&A for you to answer those, Aloisio, just being conscious of the time, and would like to move on, and thanks a lot, to Claudia Kappa, who is the senior advisor at UNICEF, who is going to talk about another profile, the early childhood development profile. Claudia.
Good morning, everyone, and thank you so much, Tis, for giving me the floor and the opportunity to present the ECD country profiles. As Tis mentioned, these profiles on ECD are part of the family of the profiles that were released as part of the Countdown activity and have a specific focus. We wanted to present in one place the latest information to assess country progress in improving the health, development, and future prospect of young children all over the world. This work is the result of inputs and support from many different partners. There is a dedicated technical working group within the Countdown to 2030 partnership that has a specific focus on ECD. The group is chaired by Linda Richter, who has been really the force behind the ECD profiles and remain front and center in advancing the ECD profile work. Linda couldn't be here today, but is really the person who has been pushing for giving dedicated attention to younger children in the context of this broader effort to provide evidence that can inform policy and advocacy. But we are also very fortunate to have a number of experts coming from different fields that contribute to the country profiles. And here are the list of those who have been deeply involved in guiding and steering the profiles. There is a UNICEF production team, because since 2019, UNICEF has been responsible for putting together the profiles. And I want to acknowledge Nicole Petrosky from UNICEF side, who has been coordinating the production. But that has been mentioned also in the context of the other profiles. There are many different contributors to the profile, because the profiles build on global databases, and it takes efforts from many different experts within UNICEF and outside of UNICEF who have really been working and compiling this wealth of data over a number of years. So it's truly a collective effort. Now, the development of the profiles was framed around the conceptual framework that was developed through this joint partnership around the nurturing care for early childhood development. So this is the framework that we've been using for identifying the key measures that are embedded in the country profiles. And in the context of the nurturing care framework, there are 5 main components that are deemed to be essential for reporting on early childhood development, which include good health, adequate nutrition, security and safety, early learning, and responsive caregiving. So these profiles are really like cross-sectoral, in that we know very well the development of young children is based on inputs and outcomes related to many different aspects of their well-being. But we also wanted to acknowledge the importance of facilitating environments to support the different components of the nurturing care framework. So in the profile, we also give space to policies related to caregivers, communities, services more broadly. And obviously, in the identification of the ECD indicators that are used in the profile, we use the SDG framework as well, because of course we wanted to acknowledge the importance of putting early childhood development at the center of the global development agenda. So this is what the profiles look like. Currently, these profiles are only available in a static form. They are downloadable PDF. We are constantly trying to innovate, and we are learning from the work that has been done and presented today by the other countdown groups. So we will be soon moving and exploring different formats for this profile to ensure that they are widely used and they're accessible as possible. But currently, the current version of the profile is based on 42 indicators, 4 of which are related to demographics. We have 8 related to threats, what we call threats to early childhood development, like for instance, maternal mortality or low birth weight, child poverty, for instance. Then we have a dedicated section of the profiles that measures outcomes and impact. So we have measures related to, for instance, children at risk of poor development, with some level of disaggregation by sex of the child and place of residence. We have measures related to children developmental status and functional abilities. Then we present data organized for each one of the 5 components of the nurturing care framework. So as I mentioned, we have health that is represented by 4 indicators, nutrition with 3 indicators, security and safety with 4 indicators, early learning with 4 indicators as well, and responsive caregiving, for which currently we do not have measures because there is still methodological work that is necessary and ongoing to fill data gap in terms of developing metrics that can be used by country to report on responsive caregiving practices. And lastly, when it comes to the facilitating environment, we have 5 measures related to policies, and then 4 measures that are related to international conventions. As it's been mentioned also in the case of the other profiles, the main data sources that are used to compile the data that are relevant for the profiles include UNICEF-supported multiple indicator cluster survey, it's an international survey program that has produced data for over 100 countries and a number of different, 200 countries and 100 indicators. We also rely heavily on the USAID-supported demographic and health surveys that again has been mentioned by the previous speakers. But we also compile data coming from national surveys that use comparable methodologies, and they are not part of international programs. We also rely heavily on databases related to policies and also country data published in high impact journals. Of course, the consideration related to the process of review and validation of the data applies to the ECD countdown profile as well, with a couple of exceptional measures for which we do not have direct country level data, but they are based on indirect estimations. To support the understanding of the different measures that are used in the context of the ECD profiles, we have a technical appendix where the metadata information for all the indicators used in the profile is also available. Now, this map shows the gradual evolution, if you want, of the ECD country profile since their first release in 2018. At that time, we were able to release data for 91 low and middle income countries. So this is the first iteration of the profile in 2018, which are displayed in this map in the dark green. Then in 2019, the profiles were updated. We update this profile every year and extended to 138 low and middle income countries. So we went from 91 to 138. In 2020, the profiles were again updated and extended to 197 countries, including 63 high-income countries. There was a question in the chat box related to high-income countries. The ECD profiles do include high-income country, but of course there are significant limitations in terms of the available data that I will talk about in a second. Now, in the process of developing and updating these profiles in 2020, for instance, we included 2 more indicators. So we went from an initial set of 40 indicators to an additional 2, specifically referring to ECD outcomes. So we included in the profiles a measure of ECD outcomes, and we also included a measure of disability in terms of the percentage of children under the age of 5 with functional difficulty. In 2021, for instance, in the latest iteration of the profile, we replaced the previous indicator that was related to early childbearing with the adolescent birth rate. And this was done in an effort to harmonize the type of measures that are used across the different profiles to ensure some consistency. Now, currently, the profile are available in 5 languages. In addition to English, the profile are available in Arabic, French, Russian, and Spanish. And this was done again in an effort to promote the use of the profiles. What are these profiles telling us? When we compile all this country level information, what are the main patterns that emerge with respect to the well-being of young children? And these are some of the examples of key facts that we have summarized. So first of all, nearly half of children under the age of 5 in low and middle income country are at risk of not attaining their developmental potential due to stunting and extreme poverty. In nearly half of the country with data, less than 3/4 of children are developmentally on track. Attendance to early childhood education remain low. It's below 50% of children in 2/3 of the country with available data. Less than 50% of children, for instance, in 1/3 of the countries receive the benefits of early stimulation and care at home, which we know is fundamental to foster development. And in practically all countries with data, less than 3/4 of children under 5 have access to books at home. So the picture that is painted through these country profiles, unfortunately, is a sober one. There is still a lot of deprivations and inequities affecting the opportunities for children and their developmental outcomes. And this is why these profiles are very important, because they point at areas where investment is needed. The profile also point at important gaps that persist in terms of the availability and quality of data on early childhood development. And I just wanted to point at a couple of important gaps. First of all, related to the areas of responsive caregiving. We are still missing metrics that can be incorporated in household survey and that are able to provide information on the type of caregiving practices at home. So work is ongoing, and I wanted to acknowledge the WHO work and the UNICEF, WHO, and World Bank partnership based on the Nurturing Care Framework that has a dedicated monitoring and evaluation working group that is trying to tackle some of the methodological needs that persist. We are also missing trends data. So for most of the indicators, these are recently collected data, so we do not have historical data. And of course, data gaps persist in terms of certain populations and certain topics. For instance, we are largely unavailable to report on children in residential care facilities. We do not have data on parental mental health or data that can be used for this type of products. We're still missing information on indoor and outdoor air pollution that has a big impact on children's development, etc. And this is a quick graph, and I'm about to conclude, that shows the the gap that persists in terms of available data. And these are a subset of the main domains covered by the profiles. And these charts display the percentage of country with data. And this is disaggregated by low middle income country, high income country. And we can clearly see that when it comes to certain indicators of early childhood development, particularly when it comes to data related to, of course, responsive caregiving, but also risk to early childhood development, early learning, still the proportion of countries with available data remain particularly low. So in the case of risk, for instance, to child development, we have 60% of countries in the low and middle income group with data available, but this data is not available in high income countries, mostly because these high income countries do not participate in international household survey programs that collect data on standardized module on this topic. So still a lot of work needs to be done to increase the availability and quality of data on early childhood development. I'm going to conclude here by showing you where you can find and download the country profile, the data set, and also the metadata information. This material is available on UNICEF website under dedicated pages on the country profiles, but is also available on the countdown profile, the EdCam profile, and the nurturing care profiles. Thank you so much. And of course, I will be happy to answer any question you might have. Thank you.
Thank you very much, Claudia, for the great work on the ECD profiles. Of course, an area that is relatively new, needs attention, and I think the Countdown Working Group and UNICEF and others have been working together to pull together this exciting profile. So thanks a lot. I can see really lively discussions going on in the chat box and in the Q&A, and I think many great questions. So in the interest of time, I'm also going to ask you all to put your questions for Claudia on the ECD profiles in either chat box or Q&A. It doesn't matter which one of the two, and they'll be answered there. So without further ado, I'd like to now invite Teresa Diaz from WHO, who will talk about the global strategy profiles, because I think the field of women and children's health in 2015-16 was really the first to come out of the blocks with a global strategy that for 2016 to 2030 that translated the SDGs into what it meant for women and children. And in there, many indicators: survive, thrive, transform, and so on. So WHO now sort of, and we heard that already from Jennifer, is sort of taking it one level higher, broader. So all the areas within the global strategy are going to be addressed in these kind of profiles. So over to you, Teresa.
Thank you very much, Tees, and welcome to everyone. Good morning, good afternoon, depending upon where you are. I'm going to speak about the newest profiles that just came out this year in the end of September, and that's the Global Strategy for Women and Children's Health Country Profiles. Next slide. So sorry that it's not so clear, but the video will be clearer. I'm just presenting here an example of the country profile. This is one country, similar to what Countdown was showing you. We now have multiple different pages to the profile because of the wealth of data that exists. We include a section on demographics, key indicators, and then along the scope of the global strategy, which is survive, thrive, and transforms. And we also have one section that looks at the data gaps. Next slide. So on the key indicators section of the profile, you will see links to other profiles. And what we've done down here is that we've linked to all the Countdown, the profiles that you've seen already presented. And although many indicators overlap, there are several that are not in Countdown country profiles and vice versa, not on the global strategy country profile. But what I want to make clear is that we are using the same data source, and we specify the data source on all these profiles, including the global strategy profile, so people are aware where the data comes, and we really work together to try to make sure that everything is coming from the same data sources. Next slide. So we're going to show a video. Here is the link of where you can find the profile. And I'm going to now put on a video that will explain the global strategy profile. You can start the video now.
In 2015, world leaders adopted the ambitious 2030 Agenda, Sustainable Development Goals, known as SDGs. A new global strategy was approved by the Secretary General of the United Nations to translate the SDG agenda into concrete guidance on how to accelerate progress in women, children's, and adolescent health. The strategy includes a monitoring framework with 60 indicators to help countries and their partners promote accountability in ending preventable deaths, known as survive, ensuring health and well-being, known as thrive, and expanding enabling environments so that all women, children, and adolescents can reach their potential, known as transform. Since the monitoring framework was released, there have been several reports on progress toward these indicators. However, there was no one place that countries, partners, donors, and the public could go to review progress, see a specific country's progress, or compare progress amongst countries. Therefore, a data portal was created to visualize these indicators in one place in 2017 and was modified and improved over time, allowing visualizations per indicator with the ability to compare countries. This portal also highlights a core set of 16 key indicators and can be found in the link shown. However, this portal did not provide an ability for a country to see their own entire set of indicators and progress toward reaching these ambitious goals. We now have this ability. The global strategy country profiles can be found here. The global strategy country profiles are generated for each World Health Organization member state country. you select a specific country by using the country filter on the right-hand side of the page by either typing in the country name or scrolling through the options and clicking the country's checkbox. In the country profile, you navigate through the various pages by clicking the blue and white buttons at the top of the profile, such as Key Indicators 1 and 2, or Thrive. The country profile includes all data by default, but if you are interested in only certain sections, use the checkboxes in the Include Sections checkboxes at the top of the profile. Unchecking and checking boxes will remove and add that section from the blue navigation buttons at the top of the profile. In order to export or print, click the download symbol on the right of the profile above the country filter. Then click Export to PDF. All pages of the section selected will be added to the PDF. Progress can only be made if results of efforts are monitored and followed closely to hold the global community, country, and local communities accountable. Use the data portal and data country profiles to monitor and accelerate progress. For further questions, please go to the email shown.
Thank you, Tees, and I'll turn it back over to you.
Thank you, Teresa, for that nice introduction of the very comprehensive overview of the indicators, the 60 indicators, and I think there are 16 core indicators of the global strategy, and it's nice to see everything into one place. So we have seen, we've heard from Jennifer about a profile of the countdown, which has gradually expanded over the last 15 years to include many more dimensions. We've heard from Aloisio about the equity profiles, which also has been around for quite some time and has expanded in multiple dimensions and can really go deep, but still remain simple in terms of communicating inequalities. We've heard from Claudia on the ECD profiles, which I think is something that cuts across multiple sectors, of course, but something that is also increasingly established. And from Teresa, which is sort of the global strategy, which pulls together a wide range of indicators from Survive, Thrive, and Transform. So I hope it's not too overwhelming, but and of course there's overlap between the different profiles, but we thought, these are all very useful resources for everyone who wants to sort of take a look at what the current statistical situation is in the countries and use that to undertake action. I think there have been excellent questions in the chat box, and one of those I just want to highlight was a question. I think it was by Betsabe on, this is all based on surveys and international data sources largely. What do you actually get from health facility data, the routine data for districts, for regions, provinces that are often updated on a monthly basis and potentially could have much more frequent updating? And I think that's a great question, and many countries are working on that, obviously, through the DHIS2. They have dashboards and so on. The only challenge that's in with that kind of use is at the moment, how do you get the best possible statistics for a district with this kind of data, which of course is more error prone than a household survey, which is funded by hundreds of thousands of dollars. The countdown is working very hard with a number of countries to actually develop methods and ways to really improve the quality and analytical techniques of those data, and that these data can then be produced on a regular basis to inform annual reviews, national and subnational level. So I think whether or not this will eventually lead to something that is profile type, in other words, it can be produced in a comparable way for a large number of countries, is something of the future. But I certainly think one of the, apart from many negative things of the COVID pandemic, is that it has really stimulated interest in health facility data. So that's something for the future. But I think what we've seen today is really a rich presentation of the kind of synthesis that profiles, and we hope that this is going to be a very useful resource for everyone. I don't know if, Jennifer, are there any questions or issues you would like to highlight from the chat box or the Q&A?
No, well, sorry.
Have we been
Thank
able
you,
to keep up? Yeah, go ahead.
Yes, no, I have really appreciated the great questions in the chat. I think you've handled most of them, all of them really well. I just really like these questions around just what you were talking about around using local data sources in that next phase. So I think this is something that we want to really contemplate in the Countdown group on how we address that need, so that there's this suite of profiles that use the global databases, but that we then provide a tool for countries to use to populate their own, using their own local sources and other things. So I think that that's a great direction forward. But I think that's all I would like to say, and just also really appreciate the presentations from Claudia, Aloisio, and Teresa, just to round out so everyone can see the full set of the profiles and how they relate to each other, and also link to the whole global agenda on for the SDG framework as well. Thank you, Tis.
Right.
Back to you.
Thanks, Jennifer. So now this webinar is organized by Countdown and PMNCH, which is one of the critical partners of the Countdown, and of course a unique partnership of civil society organizations and many others. So I would like to invite now Helga Fogstedt, who's the Executive Director of PMNCH, to provide the closing remarks. Helga.
No, thank you so much, Tis, and thank you to all the presenters that have presented. I think this was a unique opportunity to actually see all of these together. So just to highlight here that there is a lot of rich information here, a lot of data that gets put together on regular basis and is made available. And so we at PMNCH are very occupied with that. We need to get these data to the right instances for decisions to be made, so that policies are influenced, financing is influenced, and coverage, service delivery coverage, and self-care and care-seeking behavior is influenced. So we're looking at ways of how to use these and expose them to the right target audiences at the right time in order to then really influence change. So please, if you have any ideas and if you have any good, if you want to collaborate, please let us know. Get back to us in PMNCH with Ilse and Laura, and we will then think about this. We are simultaneously with our lead partners here, thinking about ways of how to enhance use in order to change, make necessary change. And I think what we would also like to do is similar kind of, and I saw one of the comments in the chat box, to provide guidance, in a kind of overarching and well-organized manner, so that to provide the information to you as users, for various purposes, which profile can be used at what, and what does it cover, and where does it get its information from, and so forth, so that it becomes a menu that becomes easier for the user. We're not only doing this with the profiles, we're also doing this with sets of data visual tools that is used to taking this data and putting it more together and making it more visual. We are all was doing this for in the mind of accountability, but also in the mind of advocacy. How can we advocate for change? So please get back to us with what you think. If you have any ideas, if you have any further questions, please feel free to get back, and we will facilitate this. We are very passionate in Countdown. We're members of Countdown, and we have been that ever since the start. And so we would like to see this partnership moving to really driving change. So whatever you need, tell us, and we will then see how to put this together in a more meaningful way. And I hope this webinar is not the last one, it's the beginning of a journey together in really getting information and capacity building and so forth out there. So be a part of this, and please join us and see if you can contribute, or whatever you need that can improve this effort moving forward. So thank you from us, and hope to hear from you soon, and to see you till next time. Thank you. Over to you, Tees.
Thank you very much, Helga, and also big thank you to your team, Ilse, Laura, and others, the interpreters, and everyone on the Countdown side for making this webinar possible. And hopefully it will be used a lot, and we keep on working on it, making them better. So as Helga said, feedback is usually welcome. So thank you. Stay safe, everyone, and let's stay in touch.
Bye-bye. Thank you.
Bye. Bye-bye.